So this is a segment about Casey Means, the new Surgeon General nominee, being under fire. Under fire. So this is all brand new. This just happened like a day or so ago, I think. And now thanks to Robert, who kind of pointed me in the right direction on this one. Thanks, sir. I know you're probably watching. So first off, like, do you guys know what the Surgeon General does? I mean, I sort of do, but does the average person know what the Surgeon General
Not really.
They tell you stop smoking.
Yeah, there you go. Okay, that's right. Yeah. So, at one point I looked this up because I mean, in the past was not really sure what the Surgeon General actual job was. So they work for the Department of Health and Human Services. They're the leading spokesperson. Their focus is in public health communication. Stop smoking, right? Don't do drugs, all that. They do an advisory role to the president. Mm-hmm. Like there's a pandemic, then the Surgeon General will advise the president and Congress as well. They're the leadership of the Public Health Service Commission Corps. I hadn't heard of that one. You guys heard of that one?
It's probably something I should know.
No, I've not heard of it.
Yeah, so basically if there's some sort of public health problem, some sort of incident, they have this Public Health Service Commission Corps, 6,000 employees that can be deployed. It's sort of like a national medical response team. Yeah.
Like a United States Red Cross?
Sort of, yes, that's right. Yeah, that's a good way to think of it. And then also they do policy influence. So they shape the policy for, the United States government on different medical topics. So that's the role of the Surgeon General. So why is Casey Means so controversial? I'd never heard of her. Had you guys heard of her prior to this?
I think I saw an article about her recently, but it's probably about this. I just didn't read it.
Okay. Trade, you know this girl?
I've heard this story, but I don't know her.
Okay, all right. Yeah, I didn't know anything about her, to be honest. So why is she controversial? So I kind of did a dive on this to see, okay, why is everybody freaking out? Because, sometimes Trump will do something and people just freak out just to freak out.
Yeah.
And so I was like, oh, is this like a real freak out? Should I really be freaked out or not? So number one, she does not have an active medical license, which is my understanding is a requirement to be Surgeon General. She graduated from Stanford Medical School. She then went on to residency at University of Oregon in ENT, ear, nose, and throat. But she quit in her last year of residency. Now, on her website, she says she quit because she was disillusioned with the healthcare system. Okay. There actually has been people talking to her program director, Dr. Flint, who said that the real reason she quit is because she had really crippling anxiety and she didn't feel like that she could, continue on. There were some people in her residency class that confirmed that and said that she had a real fear of injuring patients, which, I've seen that. I remember that happening in my residency. There was people that suddenly realized that the high stress life of a surgeon was not for them. So, I'm not going to, beat her up about that. I mean, sometimes people get into things and realize it's not for them. I mean, I guess some people are questioning, if she has this anxiety so bad, should she be at such a high level position?
How would she go into this path at all if she had crippling anxiety?
Well, so that's a great question, Sarah. So, I think what probably happened with her, she got far enough into her surgical residency that she started to have to be, responsible for maybe training other residents or operating by herself. She realizes, hey, this is just too stressful for me. And at that point, she decided to quit her residency, which happens. I mean, that happens, every day in the United States where somebody realizes that it's not for them. Most people at that point would then transfer to a different residency. So they might go from surgery to radiology where it's not so stressful, or dermatology or something else. But she decided to go the holistic route and kind of be a wellness doctor is the path that she went. She does have, and that goes to the second point, is she does have very unconventional health views. She's very into holistic medicine, not as much into conventional medicine. She has this really big belief that metabolic dysfunction is the root of all people's problems, and she thinks that comes from eating certain processed foods. which is kind of funny. Trump always eats processed foods, and he picks the girl that says processed foods are bad. On this one, I do see that being somewhat of a concern for people. Conventional medicine really has been proven to be quite effective in all the research versus non-conventional medicine. Mm-hmm. And so, I can see why some people might have concerns about that. Some people say that she's very skeptical of vaccines. I kind of looked at her stuff on vaccines, and it didn't really sound alarm bells for me. I'm not a vaccine skeptic, but nor am I a vaccine militant. I've said this before. I kind of look at each vaccine and say, okay, how good is this? How effective is it? Mm-hmm. And then I kind of decide, okay, am I going to take this? And I take most vaccines, but I don't take them all. There's some I have skipped for various reasons. Not because I think they're going to kill me, but just because maybe they're just not that great. So, her vaccine stuff, I think that honestly, not to sidetrack the conversation, the United States could do a better job of informing people about how effective vaccines are. And so, maybe if that was her focus, then I could see that. The other thing is her commercial ventures. So she calls herself on her website a former surgeon turned metabolic health evangelist, which I wouldn't call her a former surgeon, maybe like an almost surgeon. So she has this wellness influencer role, and she's kind of like a social media influencer now. She got really kind of popular on social media talking about her metabolic dysfunction issues. Not her personal issues, but her concern with metabolic dysfunction. And so some people look at that and say, well, is that the role that you want the Surgeon General to have, right? It'd be like if, the Hawk Tuah girl was suddenly, Homeland Security Director or something, mm-hmm. right? It's just kind of different. It's odd.
It is weird. So,
I do think that the criticisms of her are certainly valid. I guess my biggest concern is she's really never treated patients on her own in the conventional medicine sense. Mm-hmm.
Maybe she'll be a good spokesman because that's what she does.
Well, that's a good point, Sarah.
That's her role,
in
right?
reality, does the Surgeon General out there treating patients on the street? No, of course not.
They're there to influence.
Yeah, Sarah, you may have changed my mind. That's a very good point that, if her job is to influence, then, she could probably do that very well.
I wonder if RFK picked her, because that's RFK's
RFK
mindset.
did really like her, yes. Yeah. Trump said he didn't even know her, that it was RFK's kind of pick.
But
Trey, I feel like you're about to say something. I can hear you in there.
Yes.
What do you?
I actually was. Robert Dreschel said that he hopes that she doesn't take away his Dr. Pepper. Is what he said.
Dr. Pepper.
Yes.
Well, I think Sarah makes a really good point about the fact that she would probably be a very effective spokesperson. Mm-hmm. I have kind of concerns about her knowledge base, honestly. Yeah. She hasn't treated patients for any amount of time in the conventional sense. I know she has her holistic stuff, but
I feel like she's just the top of a pyramid where all these people are going to be help her. She's going to have all these advisors that are going to help her.
You're
influence.
not wrong. At the end of the day, if she's at the top, then she's ultimately responsible.
Yeah.
The inactive medical license thing, that all kind of revolves around the same thing. Her unconventional health views. I find that a little concerning. If she had a balance where she's well, I do conventional medicine, but I also believe in preventative and holistic stuff, I'd be okay.
I like to try this first before.
Yeah, I wouldn't necessarily have a big problem. Her commercial ventures, I don't know. Do I think that there could be a better pick? Absolutely. Could there be a worse pick? It could be worse, I guess. Yeah. I can't say that I'm going to throw my weight, behind Casey Means. I just think that
she could have had her medical license taken away.
She never got it.
Okay. Well, there you go. She could have been or something kicked. She could have been kicked out.
Well, the reason she didn't have it. Well, yeah. She says she left because
she still be called a doctor?
Yes, because she graduated med school. She has her MD.
She has
okay. Yeah, but she never got her license because she never finished residency.
Okay.
Which means she never, treated patients in the traditional sense.
I see.
Cindy Hermann said, maybe I should have put my ring in the hat for Surgeon General.
You would be good at that, Cindy. Yeah, you really would. That would be very...
Why not? Surgeons don't run hospitals, do they?
Well, sometimes surgeons can be a chief medical officer, and sometimes doctors will go from like chief medical officer to CEO. Yeah, it happens. Like my wife did that. She got her MBA, and you know now she's.
But you have to get another degree, usually.
It helps for sure. So yeah, I think that it is a controversial pick. I think that the criticisms are valid. I think that certainly it could have probably been a better pick. But we'll see what happens. I mean, it's going to all play out.
Yeah.
But it's interesting. So all right, Trey, let me recap this one real quick. Today we were talking about Casey Means, Trump's new appointee for Surgeon General, or the nominee, sorry, for Surgeon General. And there's a lot of controversy around her. And I do think some of it is valid. First off, she doesn't have a medical license. She did graduate from med school, but she dropped out of residency. She said it was because she was disillusioned with the system. Her residency director said otherwise, that she had very bad anxiety and couldn't continue to do her job, and therefore she elected to do something different. So she's never really treated patients in the traditional sense of medicine. She did start her own wellness and holistic clinic where she treated patients like that. So she does have some patient experience, but in a traditional method, really not. And I do think that that's, a little bit of a point of concern. Some people bring up her vaccine beliefs. I personally didn't find her vaccine beliefs to be, anything too crazy. She is kind of a influencer on social media, which some people have questioned, is that the person that you want to be the Surgeon General? Then Sarah very intelligently said that might make her more effective at relating to the public. But I do think that the criticisms of Casey Means are definitely valid. It wouldn't be my first pick. So, but we'll see how it plays out. I mean, I could always be wrong.
Yeah.
So, all right, moving on.